Sounds good. I will get started. So I am talking today about collaborative practice agreements in the state of North Dakota. My name is Carly Smithers. For those of you that don't know me, I'm the pharmacy manager at Dakota Clinic Pharmacy. There are two locations in town. They're inside Essentia Health, and one is the South University campus, which is where I operate at. And then there is the Essentia Hospital has its own pharmacy as well, its own Dakota Clinic. And so this year has been my passion project to get the CPA up and running, and I'm going to share my experience with you today on that. I don't have any disclosures to report. However, I do talk strongly about Element Health today, and I just feel like I should tell you I'm not associated with them. I'm not affiliated, no financial benefits for speaking on them today. I'm a paying member. I'm just going to share my experience this past year of using them. Some objectives. So let's just start off with what is a collaborative practice agreement. There's a couple different definitions there for you, but essentially there is a provider, so a nurse practitioner or a medical doctor, and then there's a licensed pharmacist, and they come together to form an agreement or a protocol to operate, which allows the pharmacist to have some limited prescribing authority. Out of curiosity, how many of you guys have executed a CPA before? Okay. Anybody do it on a community pharmacy level? Okay, cool. Hopefully you've got some stuff to learn today. So CPAs in North Dakota, as kind of described there. So whenever we hear CPA, we most commonly think of it as like something that's done at a hospital level or at the VA. We rarely think of it being something that's executed at a community pharmacy. But there is a new program within the state of North Dakota called Element Health, and that allows a community pharmacist to operate and execute a CPA. I think it's important to note that you don't have to have a residency or any type of board certification or special initials behind your PharmD in order to execute a CPA. If you are a licensed pharmacist, you are qualified to do this. So why do we care? Why are CPAs important? There's a lot of things that we can do here with one. It provides a broader access to care for patients. And so this can also be important for preventing any delays in treatment. And the best example of this is our albuterol users who are maybe they're expired or they ran out of refills and it's going to be a long weekend and they would like a refill on their inhaler. We can't meet with the doctor, of course, or get that approval from the doctor. And so we can sign off that as long as they are an eligible candidate. Also, community pharmacists, we're just like the first line to healthcare, right? Everybody that works in retail or in the community pharmacy setting knows this, that the patients, they're not getting on hold with their doctor's office and leaving notes with reception and then nurse and then maybe get a call back in a couple of days, right? They're going to call their local community pharmacist. Someone's going to answer on the first or second ring and they're going to talk to a human and feel happy about their decision there. So if we are already their first line of contact, why not expand the services that we can provide to those patients? Also, a patient for affordability. So I'm going to use myself as an example here. I have great health insurance, and even with my great health insurance, I have 3 young kids. Last year, my daughter needed to be tested for strep 4 times. Every time she needed it done, there was a $50 office copay visit, and then there was a $250 lab that I had to pay for as well, on top of all the time of being in the waiting room, waiting for the lab to get posted, waiting for the doctor to see the lab, and then prescribe, and then waiting at the pharmacy. So time is money too as well, right? So every time she'd be like, oh, I have a sore throat, I'm sick. It's like, oh, dang it, it's like $300 I'm going to be shelling out in the next 24 hours here. So if there is a way for a pharmacist to provide this to be a more affordable means for patients, that could really open up access to care for people as well. We could all speak until we're blue in the face about reimbursements on the decline. And so we don't make money by putting lisinopril in a bottle anymore. We just don't. So we have to be aggressive at looking for other forms of revenue. So adding a CPA to your practice site could be one way to search for other income. And then job satisfaction. So just having that increased satisfaction of the direct patient care, putting your clinical thinking cap on has just kind of greatly improved morale. Why does this matter more in rural North Dakota? Because there was a study or some data that was pulled a few years back that showed in the more rural sections of North Dakota, we had the highest age of primary care providers. And so as those providers continue to age and go into retirement, that's going to be causing some gaps in patient care or direct access to simple services such as what CPAs can provide. So Element Health, like I mentioned before, is the way that community pharmacists can have a collaborative practice agreement at their site. I lumped them into 2 different categories. So there's a test to treat type of a CPA in which there's some type of test swab procedure that's performed Results on that is based off of how we do our treatment and diagnosis. And then there's additional CPAs that don't require any type of test, but it does require basically like a pharmacist office visit is what I have it kind of quoted or called as. So it's essentially a screening form to prove that the patient is indeed a candidate to have a CPA service. And if so, then the pharmacist, reviews all the necessary information during an office visit and makes that judgment call. All of those CPAs that are underneath the umbrella of Element Health are listed there for you to view. So if you are working at a practice site and you think a CPA could be an important thing or an additional service you could provide, the question then begins, like, where do you start, right? So points of contact, Jesse Rue and Jesse Johnson, thank you. They would be great avenues to get started if you're interested in a program like Element Health. The CAP Center has been great too. I know, Liz, you were like instrumental at getting us set up and just in connections with the right types of people in order to have us roll this out at our store. You also have a webinar on the test to treat options on how to do the swabs. In case you're someone like myself who's maybe a little more seasoned and not a fresh grad, I did not have that built into my curriculum, but you could do the webinar and get trained on how to do the swabs for the strep throat screening. So while you're connecting with the appropriate people, you could also work on getting a CLIA waiver, and that's that waiver that you have to have in place in order to be a test to treat site. I'll touch on that on the next slide. And then also just kind of strategizing with your team. So how are you going to implement it? Who's on board? You really do have to have the whole team to buy into it in order for it to be successful. So here's the CLIA waiver. There's a direct link to it in case you get access to the slides, but it's essentially a form CMS 116. It's $250. It's good for 2 years, and you do have to have that in order to be able to perform the test options. This is just a photo of what the form itself actually looks like. And then this is the one part of the form that kind of threw me off a little bit. It is where you need to list any type of test and specific manufacturer associated with that test that you may or may not use in your store. So kind of the helpful tip here is if you think you potentially could be using the test, you should have it in this little box here. Worst case scenario, you don't end up utilizing that one, but at least you're covered if you do. And the people that you're in collaboration with to get your CLIA waiver, they're super helpful. So if you have something filled out wrong or it needs to be tweaked, they are really good at communicating that to you and sending you exactly back what you need to fix and then resubmit. So in order to know what to fill in that box that was on the last slide, you have to know where you're getting your CLIA supplies from. So your strep kits, your influenza or COVID kits, whatever it is that you're choosing to do for your test to treat options. So there's a couple different choices. You could reach out to your current wholesaler. I know our primary wholesale has like an actual CLIA little team. And so I did a Zoom meeting with them in order to find out what supplies were available to us through our wholesaler. They also have a small amount of marketing that we could have utilized. We chose not to, but if you're someone who's just needing a good place to start, your primary wholesaler could be a good fit for you. I believe Jesse Johnson or the CAP Center, someone had a list of documents, of course, no affiliations or discounts or anything with that, but just if you're looking for purely information, and then CLIAwave.com has been a good resource as well. Okay, so you've contacted the right people, you got your CLIA form, you got your team to buy in. What comes next? Next is you get emailed the protocols from the Element Health, and so you get to read through them. We decided to divide and conquer, so there was like 11 different protocols that came submitted to us. We had our pharmacists each take a few, read them through front to back, and just kind of assess what would we need in order to carry this out and carry it out effectively at our store. So for example, a lot of the antibiotics, if there were any to be prescribed, if it's a pediatric patient, would have to be weight dosed, of course. And so we were going to need a scale in order to get their weight. Blood pressure cuffs, it has to be both for pediatric and adult if we're going to be screening pediatric patients. Thermometers. If we're doing strep kits, of course we need the strep kit itself, but then tongue compressors, distraction, fidget toys and whatnot for our pediatric patients as well. Appropriate PPE for staff too. So anytime we're going in for a swab, we're going to make sure that our staff has a mask on and is just protecting themselves the best they can. Once we read through the protocols, it was time to kind of create an intake form or a template that we would use for patients to fill out to do their screening to make sure that they're eligible to have the service done. And so this can be done one of two ways. So Starfield, if you want to partner with Starfield, they have a way to make that electronic. And with that, you could have Starfield text the patient the questionnaire and they could fill it out on their phone. for electronic submission, or the patient could be handed an iPad and they could fill out the questionnaire to make sure that they're good electronically. We elected to do the old school pen and paper copy just because it just was going to slide right into our workflow. We're already using the pen and paper copy for our vaccines. Anytime someone walks in for a vaccination, they're going to have a clipboard with a piece of paper on it. Please fill it out, you know, the typical, make sure you're eligible for the vaccination today. So we thought that when it came to a CPA, to have that exact same process for them would just feel very streamlined for us at our store. And then lastly, I forgot, after visit summaries. And so per the protocol agreement with Element Health is you have to provide education for your patients that you're seeing at your site. And so to me, I took that as an after visit summary. So just like you would have if you went to your doctor's office, they would issue you paperwork at the very end. This is what happened at your visit today. Tips for self-management, things of that nature. So we created forms for every single CPA protocol that we have so that we could provide education for our patients after we dismissed them once the service was over. Lastly, deciding cost and billing strategies. So this was kind of tough to figure out. I mean, what do we charge, right? We're pharmacists. We're not in the business of making money, right? We're just trying to help people out. So it was hard to figure out what would be affordable to our patients, where they'd want to come to us for the service, but not too high so that they'd rather just go to the doctor for that. We decided on 2 different tiers of billing. So if you were getting a test to treat service done, then the cost would be more. That would help for the cost of the test. It's more time intensive. There's more pharmacist time involved with that decision making as well, as opposed to just the office visit. And so getting those pricings figured out, what we felt comfortable charging our patients, not only getting that put into our pharmacy software, so there was some record keeping there, but then also into our point of sale or our register system as well, so that it can be coded for a pharmacist office visit. And patients could pay for it at the register. Here's an example of one of the intake forms that we made up. So a couple of helpful tips that we realized. So the front page is what the patient fills out. That's screening the patient essentially for the exclusion criteria to make sure that they're eligible to have that done. We learned a little bit the hard way. We've tweaked our form along the way just based off of trial and error. For example, we had a patient come in on a Friday afternoon wanting a UTI test done, and the UTI screening for exclusion criteria is quite a bit more intensive than such as like strep throat or albuterol. So she took quite a few minutes to fill out her form, brought it to the counter, and then I looked at it and went, oh, shoot, you are over 65. My protocol says I can't treat or see anybody over 65. So I had to, have the conversation with her that we wouldn't be able to help her today. And she seemed frustrated. It's Friday afternoon, and now she's out of luck with being seen for the day. And she spent time filling out the form when maybe she didn't have to. So we've done a better job of kind of putting that exclusion criteria right at the top, or having our technicians screen upon the patient inquiry about the service they're looking for. The other thing that you need to do is have a spot for the primary care provider. Per the agreement with Element Health, we must notify our patients that we see and treat. We must notify their primary care provider that service was done in our pharmacy. And so just having that information readily available on the form is helpful as well. Here's an example of an after visit summary. So we have ours all color coded just for a quick little grab and go. If it's pink, that means this is an adult that tested positive for strep. We have our after visit summaries tailored to whether it's adult versus pediatric, and then whether they're positive versus negative. So symptom management, over-the-counter recommendations are all going to vary based off of those things. And so we wanted to really tailor our forms to be specific for whatever it was that we're treating and whatever age it was that we were treating as well. All right, so you've got the forms, you've signed the protocols. Now what, right? So it's time to market it and actually roll out the service within your store. And so strategizing on marketing. So again, we went to pharmacy school. We didn't go to marketing school. So kind of fun to wear all the different hats at the independent level here. So one thing that we did was we posted on our social media page. We have a local podcast. It's called Community Forward for the Fargo-Moorhead area. And our owner, Laura, who's in the back, was on that podcast. So she was able to kind of share our services and her passion for pharmacy. So that was pretty cool. We have bag tags. And so what that is, it looks like a quarter sheet of paper that's stapled to every single prescription bag when someone comes to get their meds. That explains additional services we offer. There's signage, of course. And then the word of mouth is what we're hoping really takes off here. So The best example of this happened last week. We had a patient come in, a teenager who needed a strep test done. It ended up being positive, and the mom was like, oh my gosh, the whole sports team has these symptoms. I bet everyone has strep. I'm going to tell everybody to come see you because this was so easy. We're like, yes. So we're really hoping that word of mouth helps us out. So then adding into workflow, we did some heavy staff training days. So we just intentionally staffed heavy on a couple different days to allow a start to finish walkthrough of a couple of the different protocols so that it just felt really seamless. And that allowed us time to like work out the kinks. It allowed us the opportunity to swab each other, to get that practice in on the strep throat swabs, just so that we felt comfortable doing it before the patient even came into the office. And then the tech involvement. So our techs have been pretty instrumental for helping us get this, going. They are great at screening for candidates at like the counter when the patient walks up. And for example, that albuterol inhaler, it was our technician that was like, hey, I have to fax your doctor, or you could see my pharmacist right now and hopefully get an inhaler in the next couple minutes. And they were like, yes, option B. So our techs have been really great at just kind of explaining to patients that there's opportunities available to them. Student involvement. We love our students so much. We have an amazing student with us right now. He's a paid intern. It's not an APPE, but he's the one who helped create every single intake form. So I give him a lot of the credit there. He basically designed them all start to finish, and then I got to put my stamp of approval or tweak as needed. And so students have been fantastic. They've got different sets of eyes and ears on things too that have been nice to just kind of add into our curriculum there. Medical billing, our student handles most of our medical billing. If we're able to bill the insurance for the service, we sure will. We're just not credentialed with all of them. And so if there's a chance for us to do some medical billing, we will tee it up for our intern to just then do the data for that. And then obviously the patient consultations, right? So a patient comes in, let's say they test positive for strep, I'm giving them an antibiotic. Not only is there a chance for our student to consult on the antibiotic, but then also have that patient information summary that's handed over to them as well, and kind of give a more in-depth consultation on even just like symptom management, over-the-counter options, things of that, in addition to the antibiotic consultation. So as kind of just previously discussed here, medical billing options, we don't have a ton of ways to bill insurances for these types of services. However, if you are credentialed, you certainly could ask or seek insurance payment. The best example I have for this is North Dakota Medicaid, so they might not be able to afford these types of services out of pocket, but we are credentialed, our whole store is credentialed as provider status for North Dakota Medicaid, so I absolutely could bill for a strep test, an office visit with a pharmacist, basically get paid for my time doing the service, which is what we want. We also want the patient to be able to have the service without having that out-of-pocket cost if there's someone who's on Medicaid in general. So certain barriers or challenges that we've encountered here. Unfortunately, local healthcare providers. So I did have an incident where a patient came in for a strep test. It was negative, against our advice on waiting, 24 to 48 hours to be reevaluated. They immediately went into a walk-in clinic, and then they were told, they told the walk-in clinic doctor, like, hey, I just tested for strep by my pharmacist, and it was negative, so I thought I'd come here and get tested. And the provider told them, never get that done in a pharmacy. It's not accurate. So that was a bummer to hear. So just kind of having to overcome the barriers and the misinformation that's out there. This same exact person was also frustrated that our office visit didn't get automatically put into the patient's medical record. And so all of us in the pharmacist world here are nodding like, well, yeah, that would never happen, right? We would never just be able to upload that record into the EMR. But patients don't know that. They think that we're trading medical records like candy out there, and it's just not the case. So again, learning from our mistakes, we just probably need to do a better job at educating our patients that, hey, if you go to the walk-in clinic, they're not going to have access to this record, but you can bring the forms that we're giving you along with if you're needing some type of documentation. So obviously, financial burdens, no matter where they're going to get the service done, could be a cost or a barrier issue at all. The pediatrics is another one that has been a little bit of a challenge. So when we practice swabbing each other, we're obviously all grown adults. And so we know to keep our mouth open, and it's going to be quick, but a little uncomfortable. We'll get it over with. But my first time swabbing a pediatric patient, I was garbed up, ready to go, had my tongue compressor down, went in for the swab, and she took her two little hands and just slapped mine down. And I was like, oh, yes, okay. this is going to be different. So distraction techniques for those little kiddos. So fidget toys, those little bubble poppers. Can you pop all the bubbles before I get the swab done? Something for them to tangibly hang on to so that they don't have that natural instinct to grab you would be good, or sit on their hands, things of that nature. We are also not against bribes at our store. So all of the suckers and stickers that you want after a visit is totally cool with us. So, and then marketing. So what we would love to see is some type of state level education to inform the community and also inform the providers that pharmacists are qualified and capable of performing these services and that they are accurate. Side note on the one that said it wasn't accurate, they were negative at the walk-in clinic too. So, just kind of a state level type of education to inform everybody of this, we would love to see happen in the next year so that we can hopefully avoid some of those misinformation things that are out there. Because it's very nuanced, right? Not a lot of community pharmacies are doing these things yet. So I have a couple patient examples. This is a 6-year-old female who presented with the following symptoms. So fever, red irritated throat with the white patches on the back, pain when swallowing, upset stomach. She vomited, swollen tonsils, and clearly she was going to be a candidate to be screened for strep throat. So pharmacist was myself. I inspected the throat. We took the vitals. Everything was good except for that temperature, but it wasn't too high to be excluded for treatment today. The swab was performed at the back of the throat, and the patient was missed back to the waiting area. Another little helpful tip is we do have the patients or the patient's family pay for the swab before it's done. It just feels a little bit uncomfortable to have them come and get swabbed and then send them away and be like, it was negative, but I still need you to go to the counter to pay for it. So just kind of avoid that uncomfortable conversation and just have them pay for it up front. That way it's just done once you have your result. If it's negative, they can just go. So we found that to be kind of a helpful step of the process. As the test is loaded, then this specific patient, it was positive. And so the pharmacist, which was myself, obviously based off of the protocol provided to me, decided which antibiotic was going to be best. This specific kiddo had an amoxicillin allergy, so we went with azithromycin. This is a weight-based dosing, so pretty standard there. Luckily, we got the weight during the vitals, and so a patient was prescribed an appropriate treatment, and that specific prescription then is billed through their private prescription insurance. So then, as mentioned before, they get their antibiotic consultation, they get their aftercare visit summary, and they get to go on their way. The entire interaction for this specific one was about 20 minutes. And when you think about bringing your kids to the walk-in clinic, you're often waiting for longer than 20 minutes in the waiting room. So the fact that they could be in and out with the result and their meds is pretty phenomenal. This is another example of a non-test to treat option. So this is a 55-year-old man who presented looking for his albuterol refill, which we did not have one on file for him. It was either expired or out of refills. I can't exactly remember what the story was with him. He was really concerned about going the whole weekend without his inhaler because it was supposed to be a really smoky weekend. As you know, this summer we had a lot of issues with that. So the technician was the one who screened him, found out he'd be not only a candidate, but he was interested. The patient filled out the questionnaire, that intake form, and then the pharmacist met with him in the office to discuss whether or not he was a candidate, screen for any medications he's on so that we could assess for any medication drug interactions there. And then eventually he was prescribed albuterol, and that prescription was run through the patient insurance. Again, similar thought process there. Documentation was done. He was provided handouts and consulted on his new prescription. So what happens after the patient leaves? We have to provide appropriate documentation for our own records. On the back of our intake form, that was for where the pharmacist fills out everything. That's how we had it set up. And so that's kind of handy for us to be able to just go through and circle, write in the vitals. On the back of that form for the pharmacist review, we also have included a table for the protocol of which medications we can prescribe so that it's just a quick little circle for us, and then send that back to the technician to do the data entry in the computer system to get that computer or the prescription generated through the software. Per the agreement, we have to alert that primary care provider, and so just making sure that we're taking care of that on our end. And then also in terms of the Element Health Agreement Plan, we do have to notify the provider that also signed our agreement with us. So whether that's that medical doctor or that nurse practitioner, they need to be in the know if we're using their name to prescribe medications, right? So That would be just per their discretion. So sometimes providers want to know, like, every time you send a prescription under my name, I want to know that it's done. Some providers are a little bit more like, just update me monthly. The biggest thing that they're trying to track is that patients aren't doing away with their primary care provider and just using the pharmacy services, right? We don't want to be taking them away from their primary care. So anybody that's repeating the service multiple times, they're obviously excluded, but then providing that information to the provider in the CPA agreement is just going to help make sure that we're not treating someone too many times. If that makes sense. Got references there. We'll break off into the roundtables soon. I just have a picture of my team here. I love my team so much. This is all of us with our Dexcom sensors on. And so one of the CPAs that's available under Element Health is to prescribe glucagon. So if there's any practice sites out there that are already doing the CGM monitoring, you could easily incorporate that into your part of your CPA. So